me the sun, baby.
NJ80. All right, y'all. We have 100 right now. I feel like we can just get started with a quick little introduction. Dr. Stan can tell us a little bit about herself, and then we can get into the topic. So,
Yes,
yeah.
yes. I feel like if you know Black Girl Vitamins, you probably come to one of our webinars. I'm one of the medical advisors. I'm a board certified internal medicine physician. I'm also a certified menopause physician as well. And I'm a clinical professor for Michigan State University's College of Human Medicine. So I teach medical students, and I work primarily in an outpatient setting in primary care internal medicine. Love what I do, love educating. I realize I can only be so many people's doctors, but I love these type of forums where we can share information. And my biggest goal is to educate you so you can advocate for yourself. That's the whole goal of this. It's great seeing y'all connecting. We gonna jump right into it.
Yes, y'all. So this is Finding Your Balance with Fibroids and PCS. And Nicolette, yes, you will be able to have the recording at a later date. We'll upload it onto our YouTube channel. And LaDeja just put the or no, she can put the link in the chat. All right. So the first question is, what is PCOS and what are some early signs that women often overlook?
Yes, this is a great startup question because if y'all have come to my webinars, you know I like to set a foundational framework. So PCOS, it stands for polycystic ovarian syndrome. So that's what the letters are standing for. And what it means is it's a really interesting phenomenon because it's not necessarily all a reproductive condition. It's not all necessarily endocrinologic. It's kind of like it meets in the middle between both. It's a syndrome. And so with any syndrome, you would need two out of three qualifiers to have a diagnosis of PCOS. So your ovaries, I like to do like this. Your ovaries, you have two of them. You're born with two of them. Most women are, and those ovaries, they're responsible for making hormones and androgens. And some women, those ovaries have follicles, and those follicles can be in excess, and that's where you get the polycyst. So it's not really cysts, but it's more so multiple follicles. And these follicles can produce a lot of different hormones that then give you a myriad of different symptoms. So most women, just to put it in layman's terms, most women clinically, one, can have changes in their menstrual cycle. So that's the first thing. So some women may not have a period every month. So it's defined as having less than 10 periods a year. Or if your periods are they come greater than every 35 days, or they come less than every 21 days. So that is when we talk about irregular menstrual cycles. So that's one of the first and most common diagnostic criteria is irregular menstrual cycles, but irregular menstrual cycles that don't allow us to ovulate. So when you have a menstrual cycle, the goal of it is to produce an egg that is viable to release, to meet with sperm and make a baby essentially. So when we essentially have PCOS, you could have months where you don't ovulate. So that's a big deal there. Then, like I was saying, the ovaries, a part of their job is to produce hormones and androgens. Those hormones and androgens are in excess in certain conditions and certain types of PCOS. So it's a very loaded topic. And one of the things that we see is that in early signs is women either have menstrual cycles. They can also have, because of the androgen excess, they can have excess hair growth, mostly like in your chin area. We call it male pattern features or central hair growth. So mustache, a little bit of a beard, maybe some acne, hair on your chest, which doesn't get talked about a lot, but hair on your chest, hair in your groin, so not pubic hair, but hair like in your inner thighs and maybe even above your navel area. So hair in that pattern, that central pattern, is what we call hirsutism, and that's drawn by those ovaries producing too many other hormones. And so that's kind of like I said a whole lot, but that's like the big umbrella of what PCOS is, and it looks different in different women, and that's why it's very difficult and it could be overlooked. Everybody's PCOS can look a little bit different.
Wow, that's a good one. You know, you mentioned chest hair. That's one that I am not familiar with. So very interesting.
Yes.
All right. So the next question is, can PCOS cause changes in skin and hair like acne or hair thinning?
Absolutely. So those ovaries, like I was saying, the ovaries, everybody knows the ovaries as the key players that produce estrogen. We all know estrogen. Everybody talks about estrogen. But the ovaries also can produce other androgen hormones too, namely testosterone. And so when the ovaries are stimulated, they can sometimes produce too much androgen, and that's where you get the excess hair growth on your chest. And like I described, it can also cause acne on your face, and it can also cause hair thinning, hair balding as well, or alopecia is a very common phenomenon in some people's um, PCOS profile.
Wow, okay. I'm seeing some in the chat. Shanae said, interesting. I hear some women relate hair growth and chest hair issues to menopause. And yeah, someone says they weren't aware of the hair growth, and Cynthia gave a shocked face. We already two questions in, and you're already giving us information we never heard of before. All right, let's keep going, y'all. So, why does PCOS make it so hard to manage weight, even with diet and exercise?
So remember, I was telling you this is an extremely complex syndrome, and so yes, the ovaries have cysts. That's one phenomenon. Yes, the ovaries can produce androgen, but what the other thing that starts to happen is that when some people have their version of PCOS, can cause their insulin levels to increase. So it's a phenomenon called hyperinsulinemia, and I don't know if you all have been to my previous talks, but insulin is one of the big hormones that we need to help open the door for all of our cells to receive glucose or sugar. So you get hyperinsulinemia, so high levels of insulin, and then you get insulin resistance. These two phenomena, insulin's job in the body is to promote fat storage. So if you have a condition where your PCOS is causing elevated insulin levels, you're in a fat storage state all the time. So making it very difficult for some women to then reduce their weight because of this metabolic dysfunction that happens. So even I have people who do, workout, do calorie deficit, do all the things, and they struggle with weight because of this metabolic dysfunction that happens because the ovaries are producing hormone. It's kind of a big circular cascade that starts to happen.
Thank you. I'm seeing some questions. Is it hereditary? Hereditary definitely affects you, especially if you're type 2 diabetic, Precious said. And Shanae said, this is a great learning experience for me. Thank you.
And let me also say this too in terms of weight. I know we talk about weight, but as an internist, the reason why it's so important for me to know if a person has PCOS is because it can cause something called metabolic syndrome. So, like I was saying, that high insulin level, which pushes people into a state where they're constantly gaining weight, that then can predispose people to type 2 diabetes, to cardiovascular disease, to elevated blood pressure. So it's called metabolic syndrome that can all come from having PCOS. So it's important if you're having any of these symptoms to talk to your doctor because we want to know because PCOS is yes in and of itself, but some of the long-term sequelae of it are things that can impact your long-term health.
Okay, thank you. What ages does this affect? Danny asked. Is there a specific age to PCOS?
No, I mean, as soon as a woman hits her reproductive years, most experts say that it's okay to give a woman like at least 6 months to a year. You know how when you first get your period might not come every month consistently. So they give you a couple months and for your body mechanics to kind of roll out and whatnot. But if you're a young reproductive woman who's having menstrual cycles and they're abnormal in any kind of way, you could be eligible for having PCOS. So it's not an age thing, in fact.
Okay, thank you. All right, we're gonna move on. Well, I'm gonna get to the questions that y'all are asking in the chat more so at the end, but I want to make sure we get these questions answered. So, next, how does PCOS affect fertility and what options are available for women who want children? That's a really good one.
That is a really good one because, like I said, we have menstrual cycles to make an egg that's viable for pregnancy. And so ovulation is what's being affected in PCOS because you might not have a cycle every month, or the cycle you have might not yield an egg that's viable for sperm. So 100% this can affect fertility. And so it's always important to talk to your doctor about, hey, I'm having these missed cycles, whatever have you, and then seeing what kind of options are available. There are different medications that kind of stimulate ovulation. Now, they're hormonal derived medications, clomiphene and whatnot, that actually cause eggs to become, ready to be ovulated, and have a baby. So first start is getting a diagnosis. The next start is talk to your doctor when you are ready to have a baby to do it. In fact, here's the other thing the big topic that I've seen in my practice. I have women who have PCOS, right? And they struggle with weight. That's like the biggest thing that I see in office. And what we do is, what I'm finding, we're using a lot of these GLP-1s, like the Wegovy and Zepbound, that are used for weight maintenance in that population. What I'm seeing is, because of the metabolic dysfunction that's corrected with these medications, women are now able to ovulate. I've seen women who have been told their whole life, I can't get pregnant, you have PCOS, you don't ovulate, and we get them on the Wegovy, we get them on the Zepbound, and they're now ovulating every month. They're losing weight, their metabolics are better, and they're actually becoming pregnant. So that is something. If you do have PCOS, talk to your doctor. Hey, is Wegovy an option for me? Is Zepbound an option for me? Because it does help with ovulation, with which we call them Ozempic babies. Like, I don't know if you guys have heard that term, but the number of women who we have been seeing pregnant who could not get pregnant with these medications has been amazing.
Wow, that's crazy. I always just associate Ozempic with just the weight loss because I feel like that's the main trend right now. But that's
Exactly.
very interesting. Okay. So next, are there lifestyle changes or supplements that truly help manage PCOS symptoms?
Yep. So we do have, so the thing with PCOS too, like I said, women can exercise. You always want to exercise. That's just the crux. That's your foundational piece. Your diet. So watching what you eat in terms of processed foods, because processed foods can cause inflammation, which can then worsen inflammation that's caused by PCOS. So making sure you're eating a diet of whole foods, nothing processed, and keeping up with that, and making sure you have your exercise program on as well. In terms of supplements, Black Girl Vitamins, we have a PCOS relief supplement that can help with the hair growth, help with the period cycling and things. But always remember too, the supplements don't take place of the medications. They work together. Before Wegovy and Zepbound, like I had said previously, one of the first line treatments for PCOS was people would get on birth control, metformin, and spironolactone. And a lot of women weren't seeing a lot of benefit with those three. So we lean on medications and supplements to kind of help the whole picture for the person. We also have inositol, which is a supplement that can also make that insulin more sensitive. So it's some data that suggests that when you do supplement with inositol, the insulin resistance can be helped with that. So everything is kind of going to take place with everything to help the person's situation.
Okay, perfect. That's good to know. Jay Prescott asked if there's a PCOS relief that is not a gummy. No, not yet, at least. But that might be something we could bring back to the team. Cynthia said that supplement is great. I'm happy that worked for you. I see a lot of really good reviews on our website, so definitely check that out, y'all, if y'all are dealing with PCOS. All right. So, how do you know the difference between a normal heavy period and one caused by fibroids? That's a really good question.
This is a really good question. And can we just talk about periods too, real quick? So I have people come in here and I say, let's talk about your periods. And they'll say, my period lasts for 2 weeks. If your period is lasting more than 7 days, heavy in nature, you got to talk to your doctor about it. That's a signal that something is off. That's the first thing. Again, as an internist, when someone comes in with heavy periods, the first thing I'm thinking is, yes, is there a fibroid happening? That's the first thing to think about. But there's a bunch of other conditions like von Willebrand, which is a very common blood clotting issue where women's clotting factors are off, and so they bleed heavy. So if your periods are more than 7 days, definitely talk to your doctor and get a workup done. There isn't a way to know whether it's a normal heavy or caused by fibroids. The only way to really know is through an ultrasound where we actually look at the uterus.
Okay, that is a great point. Thank you. tea cake. I'm using PCOS now, along with the CMOS, omega-3, and prenatal vitamins. Oh, wow. Unique said the doctor doesn't care. Oh my God.
I'm sorry.
Oh,
That's why we're doing this to try to bridge
yes,
some sort of gaps, because I get it. It's hard out here, sis.
it is. All right. So, why are fibroids more common in Black women, and what role do genetics or environment play?
Yeah, this is a great question and something that I think stomps a lot of experts, but people don't know why Black women have fibroids more than other races. Some of the studies are suggesting that it could be a genetic predisposition to some of the stem cells that we have in our uteruses. There's also some concern with different excess like vitamin D actually has been shown to when it's low in some clinical studies is showing that when vitamin D is low, you have a higher rate of fibroids. So replenishing vitamin D has also been found to help as well. But genetics are a key factor. There's also some concern that it could be a hereditary thing as well. So if your mom or grandmother have it, there is something that shows that that's there as well. And then kind of what we're intaking. So there's some studies that show like some of the chemicals and the plastics that we use to maybe store our food can also predispose us to different proliferation as well in our uteruses.
Nice. Okay, wait. I'm seeing a lot in the chat. Most definitely. Thank you. I'll be following up with my doctor next week to see if I have PCOS. And she says she's
Good.
getting the gummies if you do. I hope that goes well for you, Jasmine. Katrina says, should she take the collagen CMOS and Chill if she's on, I cannot pronounce this medication, Dr. Stan, anastrozole?
So she's got to talk to her doctor. Talk
Okay.
to your doctor first about because
Okay.
anastrozole, aroma, that's a whole separate. You want to make sure that the liver isn't being overburdened too. So talk to your doctor first, please, sis.
Okay. All right. So, what should women know about treatment options from medication to surgery, and when is each recommended?
Yep. So let's jump back just a little bit first, real quick. So fibroids, what are they? Fibroids are considered masses of the uterine tissue, and they're responsive to hormones like estrogen, meaning estrogen in some of these situations can cause fibroids to grow. So when we talk about treatment options, surgery, etc., number one is going to depend on where your fibroids are. You can have fibroids that are in the muscle of the uterus in and of itself. You can have fibroids that are inside the uterine cavity, and you can also have fibroids that sit outside the uterus proper itself. So it's going to depend on if the fibroids are causing a problem. Most women that come in here, they have no idea they have fibroids, right? Because if you think about it, the only way you'll know you have a fibroid is if someone has done an ultrasound of your uterus or a CT scan that suggested it. Most of us, there isn't a way for us to just, we don't screen for them, so it's something that if you weren't bearing a child or having a problem for someone to order the testing, you may never know you have it. For
Oh,
me, again, as a exactly. So as a primary care doctor, I'll get women that come in for a physical exam and I'll go to do an abdominal exam and I'll just feel their abdomen and it's hard, it's brick hard. And I'm like, hey, this feels like a mass here. And then sure as shooting, we'll do the ultrasound, huge fibroid because most women they may have heavier periods, they may have pelvic pressure, but back pain is actually one of the biggest things I see in clinical practice. People coming in here, my back is killing me, my back is killing me. And then you go and you see this huge fibroid that's leaning on the back. So depending on in terms of how to treat it, it's going to depend on what kind of symptoms you're having and where the fibroids are. Generally, most people are going to be started on uh, OCPs or birth control because, like I was saying, the fibroids are sensitive to hormones. So the birth control, in essence, is kind of controlling it from a hormonal standpoint. Then, if your situation is that you have heavy periods, your doctor might say, okay, well, let's do something called TXA, which is a fibrinolytic agent that we can give that'll help slow down your menstrual cycles from the fibroids. Then, depending on, like I said, most women that come in here, their iron is low because they're bleeding so much. So if you're in that type of situation, those women, depending on again where the fibroids are, might be eligible for different surgeries like a myomectomy where they just kind of go around and scoop the fibroids out. There's also uterine embolization where they can actually go and make the blood flow to the fibroid stop. And then there's a bunch of other like lasers and different hysteroscopies where they could just kind of grab it. So it depends on where the fibroids are, what kind of symptoms that they're causing, and where you are in this space.
Thank you. That was really nice. I have a question. I don't remember if it's on the presentation, but what is like the biggest size that a fibroid can get to?
Oh, I've seen them be as big as a baby. To be honest, like that, I've seen them be as small as your fingernail, all the way to making a woman look like she's 9 months pregnant.
Oh my goodness.
And a lot of my really good friends at GYN, and she always tells me like we got the imaging done, but
Mhm.
it wasn't until I got into the actual uterus where I saw how big this fibroid really was. And it just breaks my heart because women don't it's hard because people don't feel comfortable talking about their periods. And so they go all this time without knowing that this is a fibroid situation and just kind of deal with it. They push through because they don't feel comfortable or don't or think it's normal. Like, oh, okay, my back hurts because I haven't worked out. But it's really because you got this fibroid laying on your
Oh
spine.
my goodness. Women go through so much, y'all. I can
So much. Like it's insane.
Oh my goodness. All right, moving on. How do
Mhm.
fibroids impact pregnancy and overall reproductive health?
Yep. So, like I was saying, depending on where your fibroids are, if they're inside the uterine cavity where the baby's gonna go, a fibroid could effectively affect where the baby implants. It can affect, different things like where the placenta is. It can cause more at-risk bleeding. If a woman's uterine cavity is full of fibroids, there's nowhere for the baby to go, and so that could cause some what may be perceived as infertility, but the baby couldn't implant anywhere. So it's always important to, again, if you know you have fibroids or are you concerned or have any of these issues I'm talking about, get assessed. And that's why also too having a preconception counseling appointment with your GYN to get these questions out there so you know ahead of time where you are. And I've even had, and even me, I'll tell you my personal story with my second son. I don't have fibroids. I don't have any fibroids in my uterus. However, when I had my second son, there was a fibroid right at the edge of the cervix that would have potentially blocked his ability to pass through. And so we watched it grow during the pregnancy because your estrogen levels are high. And you can kind of watch this thing grow. So I have women who, like myself, never had fibroids, and then boom, all of a sudden in pregnancy, you got this fibroid now.
My
So
goodness.
yeah, it can vary with people and depending on where you are.
Wow. Okay, let me check the chat. I see M. Smith wrote something. She says, I have two fibroids behind my uterus, 3 inches and 5 inches. The doctor didn't seem concerned. Meanwhile, I was quite concerned. I have no heavy periods, and they've gotten better since exercise and changing my diet. And of course, being consistent with taking my Black girl vitamins. Period.
Awesome.
We love that.
Yes, I love that.
All right. Moving on, y'all. So, this is the question that I've been waiting for. Can someone have both PCOS and fibroids at the same time, and how does that affect the treatment?
Absolutely. I mean, they're two completely separate conditions. So I see it all the time. Fibroids and PCOS can exist. And the treatment, because the treatments are two totally different treatments, we can't do both at the same time. Like I have a lady who has PCOS. We're treating that with Wegovy now that she's on that. And then at the same time, she wants to have a child. Because that's always the question too. I have fibroids. Can I have children? And that's when you talk to your GYN about what we call uterine preservation. So some women will go in and get a myomectomy done while we're still at the same time treating the PCOS, and we can definitely do both at the same time.
Mm. Oh, that's so interesting. Okay. Belinda says, what was the medicine that was mentioned for fibroids?
So I said OCPs like birth control. Fibrinolytics will give if a person's having heavy bleeding, or if you guys have heard of TXA, that's a very common name that people say to help slow down the bleeding. And then there's a bunch of, like I said, depending on how severe the fibroids are, there's different medications that can kind of mess with the hormone cascade to help shrink the fibroids. Because some doctors, if the fibroid is so big, they'll give you something called a GnRH antagonist, and it'll kind of help shrink the fibroid so that if they do plan for surgery, that it's an easier surgery. So it just depends on where your fibroids are they causing symptoms, and your long-term plans, baby or not.
Hmm.
I like this question. Can we ask this question, Amir?
Which one?
Do fibroids shrink during menopause?
Hmm.
The answer to that question is they can, absolutely. Because, like I was saying, fibroids have estrogen receptors. So when you go through menopause, your estrogen levels are decreased. So now you don't have anything stimulating this fibroid to continue to grow. So there are some women who we find have fibroids, and there'll be a conversation with them and their gynecologist, and the question will say, should I get a hysterectomy because I have all these fibroids? Some gynecologists, if there's not an issue, they'll wait until menopause happens to see if they start to shrink and cause less problems. So that is a one perk of menopause, is that some women do benefit with the shrinkage of fibroids through this transition.
Hmm. Okay, and I saw a few questions that they came on late. Can you just briefly say what PCOS is again and just some quick signs of it so they're updated?
Yep. So PCOS stands for polycystic ovarian syndrome, where the ovaries in and of themselves they're not cysts, but they're excess follicles. So it can cause your periods to not come consistently. So we define it as having two out of these three phenomena. One, irregular menstrual cycles, which is defined as having a period greater than every 35 days or less than every 21 days or less than 10 per year. That's number one. Number two is going to be having high levels of androgen, so things like testosterone, DHEA, which we can check in the blood. Or three, we'll do an ultrasound and you can actually visualize those follicles on the ovaries. And then there's also hirsutism, or excess hair, either as a mustache, a beard, chin, chest hair, belly hair, or in your groin. And then meeting a diagnosis of PCOS comes when you can meet two of those three criteria.
All right, so I hope that answered everybody's questions. Let's see. Sherelle says, how do you know if not having a period or infertility is due to PCOS, fibroids, or menopause? What blood tests and exams should be done to make this determination?
So the question was, that was kind of loaded. Read the first part.
Yeah, so how do you know if not having a period or infertility is because of PCOS, fibroids, or menopause?
Yep. So generally, a fibroid wouldn't cause a missed period, just from a physiologic standpoint. So that's the first part. So I don't think a fibroid will cause amenorrhea or lack of a period. PCOS 100% can, and we can again by those three criteria. So cyst, elevated testosterone levels, or hirsutism, which is the excess hair. So being tested will require you to have an ultrasound to look at your ovaries, and we're looking for follicle count. Then we can also check testosterone, DHEA hormones, because the ovaries produce excess hormone. Yes, estrogen is the hormone everybody knows the ovaries make, but they also make androgens, which are going to be your testosterone and DHEA. So if the testosterone levels are higher, then that can suggest that PCOS may be something to consider. And then just looking at someone, I mean, seeing if they have a lot of excess hair in conjunction with those things too. So it's more of a clinical diagnosis with some added labs to verify.
Hmm. Okay, thank you. Talisha put a tip in the chat. She says, if you get laser hair removal, oh, she asked the question. If you get laser hair removal, will that help with hair growth?
I've seen some women benefit from laser hair growth. I've also seen some issues with women going because especially if you're a black woman, a brown woman, laser sometimes doesn't hit us the same way. But again, chin, chest, look at your belly button, look at not your pubic hair, but the hair in between your thighs as well.
Okay, thank you. See more. Okay, I'll get to the longer ones at the end. Just scanning through.
Mhm.
What would be helpful for PCOS if a woman has suffered very early in age and she is experiencing facial hair and losing hair on her head?
Yep. So PCOS can cause alopecia. And so in that situation, there's a lot of amazing treatments out, minoxidil, topical metformin, PRP, all of these things that your dermatologist can actually inject in the scalp to help regenerate some hair growth. So hair was the one, so it was a loaded question. What was the second part? So hair and what was the other thing?
The second part was, hold on, my chat got lost. She says facial hair and losing hair on her head.
Yep, so we talked about so facial hair too. We use things like spironolactone, which can actually help reduce some of the androgen and help reduce the facial hair growth as well. And then of course our PCOS relief with the spearmint can also help too.
Sure. All right, moving on. All right, so how do stress and lifestyle factors like diet, sleep, and exercise influence both PCOS and fibroids? I feel like you touched on this a little bit, but we can go deeper.
Yeah. Every inflammation. So the crux of everything I do in internal medicine outside of PCOS, fibroids, all of it, all of our issues are driven by inflammation. So when you're not sleeping well, high inflammation. When you don't exercise, inflammation. Which diet, if you don't eat a good diet, inflammation. So all of these things work together to then cause worsening PCOS, worsening fibroids.
Okay. And this is a question that is just coming off my head. So I know that there are different like teas and things that can relieve some of these symptoms. What do you think about that? Do you encourage them or?
I think everything is individualized. I think that's the thing that I want people to realize, especially with PCOS, right? There's four different type of PCOS. The characteristic person is going to look like more overweight, maybe having excess hair. That's kind of what you see. But to
Yeah.
be honest, you can get a smaller profile woman with no hair growth that just has abnormal periods and cysts on her ovaries. So it depends on what the person's needs are, and that kind of drives what I do.
Thank you. I think it may be my card. So please make sure you are muting yourself. So stay unmuted so we can hear Dr. Stan. Thank you. All right. So, what role do hormones play in both conditions, and is hormone testing useful for management?
Yep, so for fibroids, there is no utility in checking hormones. Um, It's just not, we just know that they're there and they're driven by hormones. And in some women, if you notice during your monthly cycles, is when you have more back pain, more pelvic pressure, even pain with sex, right? Like because if you have this pelvic bulkiness feeling, you're not gonna want to have penetrative intercourse. You're just not. So hormone testing for fibroids, I don't really see utility. For PCOS, however, I do check some hormones, namely a hormone called anti-mullerian hormone. Anti-mullerian hormone is something that's kind of new in medicine now that we see it when it's a little high, it can suggest that you have a high burden of follicle in the ovaries, which can be suggestive of PCOS. So that's one thing that I check. Also, if a woman's coming in and they're not having cycles regularly, I also want to check prolactin levels. That's another hormone that's produced by the brain. Prolactin is most notably when you are making milk during having a baby, and some women have high levels of prolactin, which can also cause you to have missed periods or no periods at all. And
Oh,
so I'll check. So when we check hormones, I'm looking for, as a physician, right? My question is, this is the person's presentation. What are all of the things that could potentially cause this? And that's how I drive what labs I order, if that
oh,
makes sense. So
okay.
I would do a anti-Mullerian hormone, a prolactin hormone. I will also check her testosterone, her DHEA hormones, those androgens. And that'll kind of guide me. I'll also check insulin level. If insulin is very high, it'll tell me, hey, there's some insulin levels that are high because of this PCOS. And that honestly gives me a lot of information on how I can guide this person and help treat them overall.
Wow, thank you. I feel like you explained that very well for people who don't understand medical terms.
Thank you.
All right. So, how do these conditions affect emotional health, and what advice do you give women who feel overwhelmed?
So I like this question. I like it so much because If you think about it, women associate feeling like a woman sometimes off of having periods and the ability to have children.
Mm-hmm.
So when women don't are not able to, in my experience, do either of these, it makes them feel less of a woman. Also, which I'm really big, y'all, please stop asking women if they pregnant. If a woman wants you to know that she's pregnant, she will tell you. I had a person, my same lady who had the big 8-month belly appearance, someone thought that she was pregnant. She was suffering from fibroids. She wanted to become pregnant, but she could not
Oh,
become pregnant because of fibroids. So, just the body imaging that comes along with it, right? When you think about PCOS as a woman, like, maybe you want to be a little smaller, look cute and snatched in your clothes, but you fighting this hormone imbalance and you can't. So,
mm-hmm.
all these things can affect a woman's self confidence, how they feel. If you have fibroids and you don't want to have sex because it hurts because you got this big mass, right? You're not going to want to engage with your partner. So all of this can be a lot to a woman's psyche. And I want people to know that they are not alone. Fibroids are probably one of the most common things that we see in our offices, both mine as a primary care and a gynecologic office. So what you want to do is number one, realize you are not alone. And despite how society, social media, etc., make things look like they're perfect and beautiful, they're not. We all struggling with something. The
Yeah.
first step is going to be realizing that something is wrong. Going to your doctor, hey doc, I'm concerned. I went to a webinar, I saw a TikTok. I'm concerned about these things. Can you help me work through this? If your doctor does not want to hear that or move forward with that, get another one.
Period.
So that's the start is kind of getting a treatment plan in place. Number one, going to your doctor, getting a treatment plan in place, and then working through it step by step to get to where you need to be. Because it can be overwhelming. But like I said, you're not alone. We see you, we hear for you, and this is hard. It's really hard.
Yes, y'all are not alone. It's 170 of y'all here right now with the same experience. Just feel free to keep sharing and asking questions because, like she said, we see you, we hear you. I see Cynthia said that she needs a doctor like you, and Crystal said her doctor said there's nothing to do. Like
Might
Dr.
want to
Stan
get a
said,
second
gotta get
opinion,
another
boo.
one. Get
Gotta
another
get a
one.
second opinion. Always getting it. Now, there are situations where a woman might be in a situation and the doctor's like, you got to get your uterus out. But as a woman, that can be a hard pill to swallow. I saw women who suffer from fibroids and they're like, take it out right now. I don't need it. I don't need it. Take it. Some women are like, I want to have children. I need my uterus.
Yeah.
So there are situations where, but that's why you get another opinion. Always get, because as physicians, yes, I went to med school. Yes, I did residency. Yes, I read all the books, whatever, whatever. But
Mhm.
at the end of the day, it's my medical opinion based off of data and imaging that you're going off of. So don't stop at one opinion if something isn't sounding right, feeling right. Talk to someone else.
Mhm. Oh my gosh. Whitney's comment, she said she had a doctor tell her that if the fibroids aren't bothering her, don't bother them.
Okay.
Wow. Asia said, I always get another opinion and look at the reviews. And Sister Lisa says they give up or they're just lazy.
And I also want to say too, like from a doctor perspective, right? So for me and the way my clinic is, I'm what we call an insurance accepting employed doctor. So
Mm-hmm.
sometimes too, as physicians, we are under a lot of scrutiny and push and fight. And if
Mm-hmm.
I'm being honest, the amount of time I spend fighting insurance and fighting hospital regulations that only allow me 15 minutes for a patient, when you get done fighting, sometimes you just don't have nothing left. So
Mm-hmm.
sometimes, yes, a doctor can be lazy because doctors people too, but also remember if you are an insurance accepting, if you are a person that has insurance, we are limited with what we can do. Like I wish I could just say screening for fibroids for everybody. Insurance not gonna let me do that, y'all. They just not. So like the unfortunately what how we move is based on a lot of different it's very bureaucratic. At the end of the day, the doctor's at the bottom. It's the insurance, the hospital, then the doctors maybe somewhere at the bottom there.
Okay. All right, thank you for that. That puts things into perspective a little bit, y'all. And I see people asking where she is located. She is in Detroit, Michigan. And Cynthia said, at least you are thorough and you talk to your patients. Yes,
Oh
Dr.
yeah,
Stan is a real one.
we be kicking it.
All right, so y'all, this is the time that y'all have been waiting for. So I think, Dr. Stan, let me see, it's 5:43. I think 3 questions is fine. If
Yep.
anybody wants to raise their hand and ask her a direct question, feel free to do so. We'll try to do this until like 6:55. So yeah. Okay, Keisha, you can go ahead and unmute.
Can you hear me?
Yes.
Okay, I just have a question. I had a UFE procedure for fibroids done August 25th. But my question is, once they did my MRI for it, they said they found a simple, complex cyst.
Hmm.
So my question is, when they cut the blood supply off for the UFE procedure, can that affect the blood supply to the cyst as well?
It depends on where the cyst is because like the blood distribution can be different from where they cut it off to where the cyst was.
Okay.
So yeah, you said you did have an MRI and they're gonna look at that a little bit further.
Yeah, they said they're gonna give it until November though.
Okay, okay,
So
just
he wants me to
see.
come back in November, but I'm hoping that the blood supply that they when they did the UFE, they went through my growing that it
Mhm.
hit the cyst, but he said he was worried because it wasn't a simple cyst, it was a complex one.
Complex. Yeah, I mean, I feel that, and sometimes too, it can take some time for the blood supply. You know, like when you cut the blood supply off, it might take a minute for something to die or lose its vascularity. So I
Got it.
think that's the thinking as to why you want to wait to see, but you want to also follow how you're feeling. Like, is something different? Do I feel off? Am I having a fever? Am I having belly pain, pelvic pressure, anything like that? Because again, my motto is this: you are the CEO of your body. Your doctors are just your consultants. So you have to be in tune with what you're feeling and what you're going through. And if anything feels off, you hit that doctor up.
Thank you so much. I truly appreciate it.
You're welcome.
All right. Thank you, Keisha. All right. I think it's Bridget next. Go ahead and ask your question. And if anybody else wants to, feel free to raise your hand.
Yes, hi, hello, hi ladies. I just have a question. I'm not sure if you guys had answered it already, but because I don't think I was around, but I don't know. I think I have symptoms of PCOS, and I'm not quite sure if I should go to a doctor to see more about my symptoms because I want to take your gummies. I want to try the PCOS gummies. So I was wondering, would I have to seek a doctor first, or could I just, order the gummies and take?
Seek your doctor. Get
Okay.
a confirmation first. The supplements, the key word is supplement. It's to supplement or adjunct or help, not completely obliterate medical care entirely. So you want to use them together. Talk to your doctor, tell them your symptoms, get a workup done. Then
Mhm.
after you do get a workup done, if they do tell you, "Hey, you do have PCOS," then ask your doctor, "Hey, I see these gummies. They have really good reviews. Would this be safe for me to take?"
Okay. Okay. Thank you.
You're welcome.
Okay, if nobody has any additional questions, I'll just read off from the chat. So the first one that I see is from M. Smith, and she asks for those. Oh, okay, Crystal, raise her hand. Go ahead, Crystal.
So, you answered my question in regards to the excess facial hair and thinning of hair on your head. You mentioned some medications. Now, I personally suffer from PCOS, and I knew very early on that I had PCOS because I started my menstrual cycle at a very young age, and then it went away and came back. All of the signs to know that, hey, there's something wrong. So I've had my fair share of birth control, spironolactone. I've done Victoza, metformin. Like, I've been all around the mulberry bush. And I still have not gotten any type of relief. I did try the PCOS gummies, but now I'm like, okay, is this perimenopause or is this still my PCOS? Like, how do I decipher between the two? And like, what would be a good thing? Because every time I try to find a doctor, they're all just like, oh, well, you need birth control, you need spironolactone. And I'm like, I've been through that mulberry bush for a very long time. And I kind of want to do it the holistic route. I kind of want to do it, not because every pill has a side effect. So I'm just trying to find out, like, how do I balance out my confusion and just chasing my tail?
This is a phenomenal question. First of all, I'm sorry you're going through this. Truly, I am. PCOS and perimenopause, whoo, those can look very similar. Yes, in fact, most women who have PCOS who go through menopause, they actually start getting regular cycles from what I'm seeing. So that's a caveat right there. But perimenopause, just given that it can cause irregular menstrual cycles, weight gain, hair changes, irritability at the same time as PCOS, what I'll generally ask a woman to do is talk to her doctor first, check some hormone levels. Are you having cycles? So when you do have cycles, like, have you noticed that they're just when you do have them with the PCOS, are they longer? Are they shorter? Have you noticed any change when you do get them compared to normal?
So for a very long time, they were non-existent. They would come and it would be a full 7 days. Then I started doing some herbal blends, and it got down to about 4 days. My period, though, it doesn't come every month after I've had my child. And I had my child at 39, and I'm 41 now. And so I see now after, my postpartum, it's like, is my period coming this month? Or if it's not, it's about 42 days, 43 days before I do see a next cycle. And it's rather light. I don't have any type of excessive bleeding or anything of that nature. It's just the symptoms. Like, I'm losing my hair on my head, but I got it everywhere else in abundance. And I'm not sleeping at night. I got the night sweat. So I'm like,
Does this sound
gosh,
like that's perimenopause?
okay.
I mean, not to, medically treat you on this forum, but
Oh,
that's
yeah.
what it sounds like to me. And for that, definitely looking into some Veoza, which is a new medication that's out for hot flashes, or even Arminichil. But it sounds to me with the night sweats, the hot flashes, the hair loss, because menopause can also cause hair loss, similar to PCOS. I think that trying to focus more on the perimenopausal side versus focusing on the PCOS side and see if that will yield you something a little bit different. With the hair loss, definitely talk to your dermatologist. The PRP works really, really well. And there's a bunch of different treatments that can be used to regrow hair. So I would start with that. And then with the night sweats, like I said, we have the Minichill. Did you say you tried it before?
No, I did the PCOS gummies, but I only did it for a month because I was like, is this really worth it?
Yep,
But
yep.
I have seen the reviews, and like I said, I kind of just been trying to find something where I'm not having a whole bunch of side effects. I'm not taking a pill for this and a pill for that, and let me shoot this up. Because I even tried the GLP-1s for the weight loss because I was gaining a lot of weight, and I was like, okay, so something is off.
Mhm.
But I had to stop that because I was having side effects. So it's just like, what's
Yeah.
going on? Like you said,
Yep.
it could be more so the perimenopause than it is the PCOS.
That's what I hear. When you had me at night sweats, you had me at the weight gain. Like that's I hear more peri than PCOS.
Well, I wish
Definitely talk.
Perry sit down somewhere.
I know. Talk to your doctor though. Make sure if you are taking any other medications, they're okay with you trying the Minichill. Because I know you said that you want to do something more herbal, and you could potentially use a Minichill and see if you get some relief with that.
Okay, I appreciate that because I'm not on any other medication. I decline the spironolactone, I decline the birth control and all of that.
Hmm.
Because I just I don't know. I'm in the medical field myself. I'm not a doctor, but I just know that the medical world is forever changing. And it's just you take a pill for this and this might happen. You take a pill for that and this might happen. So it's kind of like, you just teeter-tottering.
You
And I'm
are.
and like I said, I've been going through it for a very long time, and nobody seems to have a solid game plan. It's either, here you go, one pill here for this, and one pill for that. And I'm just tired of swallowing all of them.
Yeah, you definitely look into the Minichill. And what you want to do too, anybody taking Minichill, make sure y'all doctors are checking y'all liver enzymes because the black cohosh, and like I said, supplements, medications, everything may have a side effect. I mean, it just comes along with living and taking stuff and having very individuality with our bodies. So I think that the Minichill with the black cohosh in that, which is going to be the supplemental part that kind of helps with the flashes and the night sweats. You want to make sure your doc is checking your liver enzymes too, because there are some studies that show that you can get liver toxicity if you take it too much. So I would
Okay.
definitely try that, let your doctor know and follow through. And let shoot us an email too if it does help you out. And we'll
I
definitely
sure
be
will.
praying for you too.
Really appreciate that.
Hmm.
Thank you, Crystal. All right. I think it's Shayla from last time. We can do it very briefly, and this will be our last one.
Um, I just wanted to ask, because I think, well, me personally, and I've been checked by my women's health doctor and everything, and I went to different specialists but nobody could seem to answer my question. But I think, me personally, I think I've been in perimenopause since my late 30s.
That's very possible. I mean, in Black women, we start earlier than other races. I see women 38 years old, full blown hot flashes, no periods, the whole nine. So it's definitely,
And then when
definitely.
I started dealing with all that, I'm like, what the heck is going on? So
Mhm.
my women's health, she checked my blood work for for menopause, I guess, signs or whatever. And she's like, "Oh, you still have your period?" Yeah. And I'm like, I've been dealing with this for a long time and nobody could answer. So I thought it was dealing with my thyroid, but my endocrinologist, she was like, "No, you're good with that." And I'm just like, I've been dealing with this for a while. So for me, I kept saying to myself, it's perimenopause. I don't care what they say. So I know you were mentioning about the mental chill. For me, I'm very attentive, like doctors, even though I know I'm not a doctor, but I read a lot and try to understand. And I talk to my doctor about a lot of stuff. Um, so I started the mental chill, and yes, I know I'm on Synthroid, but what I try to do is I try to take my Synthroid like normal, and I try to spread out the mental chill like later on in the day. But to me, I think it may be helping with those night sweats because I don't seem like I'm just because what was happening for me, I have to watch my hydration. And what it was causing me to sweat because when I'm cold, I bundle up like I'm freezing to death, like it's a blizzard. So if I'm
Yeah.
asleep, I'm not waking up, so I'm sweating, and I get up and I'm feeling lightheaded. So I've been
Mm.
dealing with that for years. So I was like, you know what? So I started trying to drink a lot of water, and I know my history when I was in 18 in basic, I passed out, so I had to watch myself anyway. So me putting it together what doctors have did and everything, I was like, keep drinking a lot of water. I try to drink like 3 bottles before lunchtime, and I started the mental chill recently. And to me, I think it's helping some.
Okay.
So because I don't feel as lightheaded as I have been when I wake up in the morning. And I was like to myself, I was like, I told y'all, I was like, I listened to the doctors, and my grandma said, Shayna, stop telling the doctor what to do. But grandma, sometimes the doctor not listening. I've been telling them this is what I think it is. Because you done tested this, you tested that, you did this blood work, that blood work. And I'm reading and I'm like putting this two and two together. I'm like, somebody's missing something. And then I was like, you know what? You're a Black woman, so guess what? They could be missing something. And that's how I kind of like went with it. And I just made my own diagnosis. And I was
Okay.
just wondering, is that possible from what I said that that's probably what's been going on with me?
I mean, it's definitely something that's possible, just based off of what you're saying. I think I see possibility in what you're saying, definitely.
Yeah, because I also talked to my grandmother and my aunt. They're the only ones that have had hysterectomies. And my mother, she just like breathes through. I'm like, I hope I can breathe through menopause. But yeah, that's just what I came up with. And so far, I think the mental chill is helping. So I just wanted to share that with everybody else. Because sometimes being Black women, we think it's enough to think that you're going crazy because you're a woman. But it's another thing when you're a Black woman, you try to be like, hello, something's wrong, and they're not listening.
Yeah.
So okay, well, thank you so
Thank
much.
you. Thank you for sharing.
All right.
Hey,
So moving on to y'all, little surprise. So we have a special 20% off on all of our products right now. If you use PCOS 20, it is live for 24 hours. And of course, we talked a lot about PCOS relief. So definitely go get that. Go get the mental chill. You just heard Shayla's testimony. So it definitely works. Check out those reviews on our website. The recording will be available on our website at a later date. So make sure you get that. You share it with someone who needs it. And yeah, Dr. Stan, did you have anything else that you wanted to share?
No, I think go see y'all doctors, y'all. And like I said, if you're not satisfied, change. I think that BGV share my Instagram. I'm trying to do a lot of videos just about common things I see in internal medicine practice, ways to help. I just want to help. I know I can't be everybody doctor, but I can at least again help y'all advocate for yourselves. And I want us to see us win. I'm looking for a win for us finally. So we in this together.
Yes, and you're definitely helping us win, Dr. Stan. Thank you so much. As always, we appreciate you. And everybody, y'all just have a beautiful night. Bye.
bye bye. Thank you.